Hello, I'm Phil from Addiction UK, and today we're going to talk about ADHD and substance abuse. Attention Deficit Hyperactivity Disorder, or more commonly known as ADHD, is a common neurodevelopmental disorder often occurring in childhood and sometimes progressing into adulthood. The symptoms of ADHD include having significant difficulty paying attention, staying focused or completing tasks, and finding it challenging to stay seated, often being fidgety or restless. While ADHD is most commonly associated with childhood, a small percentage of cases continue into adulthood, frequently evolving into ADD or attention deficit disorder. A recent survey found that about 15% of adults who have ADHD had abused alcohol or drugs in the past year. That is nearly triple the rate for adults without ADHD. The question arises, what causes these individuals to abuse alcohol or drugs? Several studies have shown a strong link between ADHD, alcoholism, and drug abuse. Generally, ADHD is 5 to 10 times more common among adult alcoholics than in people without the condition. Individuals with ADHD tend to be more impulsive and likely to have behavioural issues, which may precede alcohol and drug abuse. The receptors in the brain that are involved in ADHD are the same as in substance abuse problems. This also suggests that ADHD patients are prone to develop addictions or vice versa. Furthermore, both ADHD and substance abuse tend to run in families. So if a child with ADHD has a parent who abuses alcohol, the child is most likely to develop an alcohol abuse problem in adulthood, being predisposed both genetically and behaviourally. Individuals with ADHD commonly self-medicate for relief from the related symptoms. Treatment of ADHD and substance abuse together can prove challenging, since medications are almost always used to treat ADHD, and some of these drugs can become habit-forming. Stimulants drugs such as Ritalin and Adderall are primarily effective at managing ADHD symptoms, but they also have some possibility of abuse. Alcohol use combined with ADHD is a dangerous mix that is likely to lead to dependence and addiction. Many persons drink alcohol to help them relax, since it is a depressant. However, in the case of individuals with ADHD, they may use alcohol to soothe their hyperactivity. The effects of alcohol are similar to the symptoms of ADHD. In both cases, the brain's frontal lobe is mainly affected and reduces the individual's ability to think clearly. When the effects of alcohol are paired with those of ADHD, this can worsen the symptoms of ADHD. If a person stops drinking suddenly, they may experience withdrawal symptoms, which is likely to cause increased mental and physical symptoms of ADHD. People who have ADHD are more prone to use drugs or alcohol to cope with the symptoms of this disorder. Other people may be prescribed stimulants to treat ADHD and consequently develop drug dependency. Both circumstances can lead to a cycle of addiction that may require professional help. So how do we treat co-occurring disorders? Individuals with ADHD are highly vulnerable to developing a co-occurring substance abuse disorder. But this doesn't mean that they can't be treated. A dual diagnosis integrated treatment program that will treat both ADHD and addiction can be effective for these individuals. To treat co-occurring conditions, both disorders must be treated simultaneously. When one of the conditions goes untreated, it may trigger the other condition. Treatment for addictions involves detoxification, supportive counselling, skills training, and an effective relapse prevention plan. Adult ADHD or ADD may require pharmacological treatment, along with coping strategies to deal with the attention deficit and/or impulsivity and hyperactivity. A comprehensive treatment plan and a supportive care team is essential for an individual's holistic and continued recovery for a happy, fulfilling life.